Hi guys, and welcome back to Mchikky series. In today's video, I'll be talking about breast cancer, its prevention, and how to do breast self-exam. This video is only informational and not to assert any opinion. Before you seek for any treatment, remember to consult your physician. The month of October every year is known as Breast Cancer Awareness Month. This annual international health campaign starts from 1st October and ends 31st October. It is organized by major breast cancer charities to increase awareness to breast cancer and to raise funds for research into its cause, prevention, diagnosis, treatment, and cure. It also educates people about the importance of early screening in the prevention and treatment of breast cancer. Breast cancer is the most common cancer in women, and it accounts for 30% of cancers in women. 1 out of 8 women who live up to 70 years of age will develop breast cancer in her lifetime. Physically active women are 25% less likely to develop breast cancer than those who are inactive. Early detection of breast cancer saves life. There are several risk factors that affect your chances of getting breast cancer. However, having one or many risk factors do not guarantee you getting the disease. Apart from gender, increase in age is the most significant risk factor for developing breast cancer. Other risk factors include early menarche, late menopause, hereditary factors, lifestyle choices such as smoking, alcohol consumption, and obesity, dense breast tissue, exposure to estrogen, which includes birth control pill, postmenopausal hormone therapy, having first child after 35 years, or no pregnancy at all. The more estrogen a woman is exposed to in her lifetime, the greater her risk of breast cancer. Some studies suggest that breastfeeding reduces the risk of breast cancer, especially if a woman breastfeeds for more than 1 year. Early signs of breast cancer include a new painless lump or thickening in the breast or armpit area, persistent changes in breast shape and skin color such as thickening, swelling, dimpling, distortion, tenderness, skin irritation, redness, scaling, and prominent superficial veins. Nipple changes including ulceration, retraction, inversion, and nipple discharge without squeeze. How do we control breast cancer? Breast cancer control aims to reduce the burden of the disease and to improve the quality of life of each patient in a defined population. According to World Health Organization, prevention offers the most long-term cost-effective strategy, and between 30 and 50% of all cancer cases are preventable. The 4 basic components of cancer control include prevention, early detection, diagnosis and treatment, palliative care. Actually, there are no exact ways of preventing breast cancer. However, there are things that can be done to reduce the lifestyle-related breast cancer risk factors, including adopting a healthy lifestyle, staying active, and being aware of breast cancer risk reduction strategies. Some risk factors cannot be prevented, such as gender, age, race, ethnicity, genetics, and family history. Other risk factors such as birth control, taking hormonal drugs, and hormone therapy after menopause have to be discussed with your physician after weighing the possible risk and benefits. The increased risk of breast cancer is clearly linked to drinking alcohol. Moderate consumption of alcohol increases the risk of breast cancer by approximately 30 to 50%. Therefore, you can reduce the risk of breast cancer by avoiding or limiting the amount of alcohol that you drink. Research has shown that practicing sports for more than 1 hour a day reduces the risk of breast cancer, and this applies to women of all ages and sizes. It is important to get regular physical activities. Increase in fat tissues after menopause can increase estrogen level, which increases the risk of breast cancer. After menopause, when the ovaries stop producing estrogen, estrogen comes from fat tissues. Therefore, maintain a healthy weight and avoid being overweight. Balance your food intake with physical activities. There is no single food or diet that can cause or prevent cancer. However, fruits, vegetables, and whole grains are known to contain phytochemicals with antioxidant, anti-estrogen, and chemopreventive properties that may prevent cancer. Therefore, increase intake of fruits, vegetables, and whole grains, and reduce the intake of highly saturated fats such as cream, beef, cheese, butter, and ice cream. 5 servings or more of fruits and vegetables daily are recommended. Remember, early detection increases the chances of breast cancer survival. Many women with breast cancer do not have symptoms, but sometimes breast cancer is found after symptoms have appeared. Therefore, making early detection is very important. This involves detecting and diagnosing disease earlier before the onset of symptoms. It is the best strategy to prevent deaths from breast cancer. Getting regular screening tests is the most reliable way in finding out breast cancer early. Screening tests can be done through breast self-examination, clinical breast examination, and screening mammogram. Breast self-examination is the first step to detecting breast cancer and familiarizing yourself with any changes in your body. It is recommended to begin self-exam at age 20. This aims to recognize the normal texture of your breast and also report any breast changes to your physician. For people who still menstruate, the best time for the examination is 2 or 3 days after your period ends. when your breasts are least swollen and tender. If you no longer menstruate, perform this exam on the same day of each month. Breast self-exam can be realized while standing in front of a mirror, lying down, or in the shower, using 3 middle finger pads to examine the breast using circular, straight or wedge pattern. In front of a mirror with your arms by your side, inspect both breasts for anything unusual such as lumps, distortion, swelling, dimpling, puckering of the skin, and discharge from nipples. Clasp hand behind your head while watching closely in the mirror. Press hand forward and check for changes in shape and contour of the breast. Continue checking as you place your hands on your hips while tightening your chest muscle and upper body bent forward slightly. Gently squeeze each nipple and check for discharge. In the shower, it is easier to find lump when the skin is soapy. Raise one arm and using 3 middle finger pads of the other hand, press firmly and feel around the entire breast area for lump or thickening using circular, straight or wedge pattern. Lying on your back flattens the breast and makes it easier to examine. Lie flat on your back and place your left arm over your head with a pillow or folded towel under your left shoulder. Using your right middle fingers, feel your left breast in a firm, smooth and overlapping circular pattern. Starting from your nipple to the outer edge of your breast, including underarm area, repeat on your right breast. Remember, breast self-exam does not replace periodic examination by a qualified professional. Breast examination should be performed in combination with clinical breast examination and mammogram depending on your age and risk recommendation. Clinical breast examination is performed by a nurse or a doctor in addition to self-exam. It is recommended that women in their 20s and 30s have a clinical breast exam every 3 years. Women over 40 can be examined annually. There are things he or she can feel or detect that you never consider to be important. Screening mammogram is a common imaging technique which detects non-palpable breast cancer before they are big enough to be felt. However, there is controversy surrounding its value in prevention of death from breast cancer. Annual screening mammogram is recommended for every woman above 40 years of age and starting at age 30 for high-risk women. Women with strong history of breast cancer are advised to have magnetic resonance imaging (MRI) of their breast performed in addition to annual screening mammogram. MRI has been found to be more sensitive than mammogram and clinical breast exam in detecting invasive breast cancer in women at high risk of familial breast cancer. Breast cancer treatment can be very expensive, and the main types of treatment available include surgery, radiation therapy, chemotherapy, hormone therapy, and bone-directed therapy, but not without side effects. Be your own best friend. Lower your risk of breast cancer and increase your chances of survival if it occurs by exercising regularly, limit alcohol intake, get enough sleep, and avoid chemicals that can cause cancer. With this, I come to the end of this video. Continue to share this message as part of the breast cancer awareness and sensitization. Leave your comment below, like this video for more content, and do not forget to subscribe to this channel. See you in my next one.